Here cases are rising rapidly, taking stock of the situation with all the vaccination program, all COVID-related issues, with the expert panel headed by Mr. Dr. Paul, as well as the Principal Secretary to the Prime Minister, the Cabinet Secretary, because this curve is even beating the United States and surpassed Brazil, and it's in that context that they need to really address what can be done in terms of tackling this situation. So that's the reason why the Prime Minister has decided to take stock of the situation himself. The Cabinet Secretary, as you're well aware, held a meeting 2 days ago with Chief Secretaries of the states. In particular, there were 11 states which had really shown cause of concern. And it's in that context, Sonal, the Prime Minister now taking stock of the situation and looking at how we can involve not only the private sector, but this becomes a mission amongst the country, a national mission to ensure that people not only mask up but stay safe and try to beat this curve in the United States of America.
Right. Sunil, the big question on anybody's mind whenever we think about a high-level meeting being chaired is, are there going to be more restrictions put into place? I know lockdown is a word we are told the Prime Minister's office is going to stay away from, but we're already seeing micro lockdowns of sort being put into place in different parts of the country, especially the hotspots. Is that being considered at all?
Well, as you're well aware, the last time round, that mistake of a lockdown that happened 1 year back, now they have realized that it has to be left to state-specific, district-specific, to containment zones. So we are definitely going to see if there is a talk of a lockdown, there will not be that concept of a national lockdown is a thing of the past. That's not going to ever happen again. But definitely in specific states, in specific areas, in specific parts of the city or in towns where there has been a spiraling of cases, definitely respective state governments will have to take control with the National Disaster Management Authority to ensure that these super spreader districts or states or areas get confined and do not get spread across. So definitely that will definitely be one of the things. But I think the most important is to ensure that more and more people take the vaccination, mask up and stay safe, and ensure the only way to fight this COVID virus, as has been pointed out by experts, is to get the vaccination as soon as possible.
Right. Sunil, one more question really, and this is about travel now. More and more doctors that we are speaking with talk about this second wave of virus and the second wave of infections coming in, all thanks to the double mutation and the various variants that have traveled to India from abroad, specifically the UK variant. And now doctors are talking about how travel bans should have been put into place, travel restrictions, at least in non-essential travel, something that the country needs to cut down on. Is that something that the committee will sort of discuss?
Well, there will be deterrence to that. You can't stop travel completely. There will be deterrence to it. As you're well aware, there are now people who are coming from Dubai and various are from UK and other European countries have to do compulsory RT-PCR. And on the, being found positive, they will be having to follow quarantine. There will be definitely deterrents that are put up, but you can't do a carte blanche approach of restricting travel, because that becomes extremely difficult. So as I said, I think the best remedy right now, apart from these various strategies that they have adopted in terms of how to restrict people from traveling, will be difficult. But to see how much and how you can increase the vaccination and see that those super spreader districts and towns are contained, that there are certain restrictions kept there to ensure that people remain safe, because we just definitely don't want to lose this battle at this critical stage.
All right, Sunil Prabhu there, bringing us at all important news that as cases exceed 93,000 in one single day, the Prime Minister is now sitting down with his top officials in the government, with all the top secretaries, trying to brainstorm on what to do next. We'll wait to hear what happens at the end of that meeting.